Upon completion of this section, attendee will be able to identify why the use of heated humidification is vital when using a ventilator, demonstrate how to drain excess condensation out of the ventilator circuit, verbalize the importance of having a temperature probe in every circuit and proper placement, verbalize alternative humidification options when the heated humidifier is not available for use. There are two types of humidification that are typically used when someone has a tracheostomy. Heated humidity, typically with a Fisher-Paykel, or an HME, heat and moisture exchanger, either in line with the ventilator or a nose if they are not ventilator dependent. The reasons why we use humidity or have to add humidity to somebody with a trach is because we are bypassing the upper airway, so natural warming and moisturizing does not happen. We should receive inspired gases at a core temperature of 37 degrees Celsius or 98.6 degrees Fahrenheit. This prevents hypothermia, thickening of the airway secretion, so ultimately plugs, airway damage by drying the mucus glands. Humidity deficit also causes loss to ciliary action, and atelectasis. There are several different types of models that are out for the heated humidifier. The most common brand that we see is the Fisher-Paykel. There are different model numbers of this brand, but they all work about the same way. Please get familiar with the Fisher-Paykel that you have in your home. The newer model Fisher-Paykel that is out is the MR850. It is actually environmentally smart. It maintains optimal humidity across a wide range of environmental conditions. In cool environments, active humidity management is employed to minimize mobile condensation. In other words, it will adjust if there is a draft in the room, or if it is really in the sunlight, it will adjust the amount of humidity that it needs. The mode button we want to have set at invasive. Patients whose upper airways have been bypassed with a tracheotomy tube. The humidifier attempts to deliver optimal humidity to the patient, which is 37 degrees centigrade at 100% relative humidity. This mode is the default when the humidifier is turned on. The power button is located below that. We should allow the machine to warm up for about 30 minutes prior to placing the patient on it. The mute button is located in the top left. The muted time depends on the alarm condition. In general, alarms will be muted for up to 2 minutes. Circuit setup with the heated humidity. Here is a general setup. We have the ventilator. We have the airflow coming out of the ventilator into one side of the Fisher-Paykel's chamber. It passes over the water and goes out the other side of the chamber, past the water trap, past the neb-T adapter if in place, and then through the tubing that leads to the patient. The chamber itself slides onto the heater plate. You want to push it as far onto the plate as possible. The finger guard will auto-lock the chamber in place. We do have some circuitry that do not have heated wires in them. The temperature will be between 50 and 65 degrees Celsius in these circuits. As the gas travels through the circuit, it cools down and condensation forms in the circuit. Water traps are typically required. Dual heated circuits are also available, meaning that there is heated wires on the inspiratory side and the expiratory side of the circuit. When you are draining water out of the circuit or condensation, points to remember: do not drain the condensation back into the humidifier chamber. Start at the patient and work your way down the tubing, gently milking the condensation towards the water trap. When draining condensation, be careful not to allow it to drain back into the patient's lungs. Having the humidifier lower than the patient's head also will help with not allowing condensation to drain back into the patient's lungs. Once the excessive water is drained into the water trap, empty the water trap out according to your care plan in your home. The water traps themselves. There are different kinds out there. Some of them have a cup on them that you will twist off and dump out and then twist back on. Some of them have a port on the end that you open, allow it to drain, and then shut up again. There's also some of the older traditional water bags that you will open up the port at the bottom, drain out, and then close it again. Some points to remember. Be sure to inspect the water trap to ensure it does not have a crack in it. You also want to ensure the water trap has been threaded correctly and that there is not a slight leak. Some of our patients do not have a water trap. When emptying that type of circuit into a container, assure that the water does not splash back onto the circuit, as this can cause contamination to the circuit. Most of our clients do have water traps in line. We do have some that do not, but as a rule, we do utilize the water trap. The temperature probe. Assure that the probe ends are securely in the circuit to avoid low alarms. If the heated humidifier is alarming because the temperature is incorrect, remove temperature probes and wipe off with an alcohol swab. Let them dry for a few seconds and return them to the circuit. Sometimes microscopic dots of condensation get on the ends and the temperature cannot be read correctly. If the patient has a fan in their room, try to redirect it so that the airflow is not directly on the patient. The temperature probe may be prematurely cooled off and cause an increase in condensation in the circuit due to sending signals to increase the overall circuit temperature. When adjusting the temperatures on the heated humidifier, be sure to make changes slowly so the humidifier has a chance to catch up. It is similar to using an electric stove. It takes a while for it to heat up and also a while for it to cool down again. Here is a sample of an inline temperature probe and also a sample of a disposable temperature probe. With a disposable temperature probe, you want to be sure that it is as close to the patient as possible, typically after the Y or the flex adapter. We have to keep in mind that we do not want to place it back at the humidifier, as it will be reading the temperature that is coming out of the humidifier, not what is at the patient. The heated humidifier water. Sterile water should be used. If a patient has a dependent flow setup, be sure to check the level of water in the bag frequently so that it does not run dry. If the patient has a manual fill humidifier, be sure to check the level on the heated humidifier so it does not run dry. Fill with sterile water when low. If the patient does not have sterile water available, at the very least, distilled water should be used. We should not use tap water, as it does contain sediment and bacteria, even if it goes through a filtering system. Heated humidifiers are not portable. They need to be plugged into the wall. An alternative to a heated humidifier is what we call an HME, or a heat and moisture exchanger. It is used to provide humidification and warming of inspired gases when heated humidity is unavailable. It retains heat and moisture present in the air exhaled by the patient. Two of the types that we most commonly use are the nose, which fits on the end of a trach tube if a client is not ventilator dependent, or an inline HME with the ventilator circuit located typically right after the flex tubing. Do not use the HME with a heated humidifier. The humidity from the heat humidifier will oversaturate the HME and increase the patient's work of breathing and decrease the tidal volume.